I'm just gonna introduce myself to those of you who've joined us. And guys, I know it was really short notice, so first I wanna thank you for making some time tonight to come on and talk about this pandemic and how it's affecting our health and our mental health. But I also want to encourage you to share the link with friends, with family members, social media, whatever, whoever you think might be struggling right now and benefit from having direct access to a family nurse practitioner and a psychologist. Dr. Sis,
Or I will say life coach.
Okay, and life coach.
A life coach, yeah.
A life coach. Gotcha, gotcha. So, Dr. Sis, why don't you introduce yourself first, and then I'll introduce myself. And we'll
Okay, so I am Cislina Ledbetter, and you can find me on social media as Dr. Sis, and I support women in living boldly and making choices that support their lifestyles and expand their ways of thinking through breathing and through holistic healing. And so I've been doing this for such a long time. Of course, for the first 15 years of our lives, when we're heart-centered professionals, we give it away. But I have been so fortunate to have an amazing career where I can serve young people and serve people that are mature. And so it's my pleasure to be working with Devyn on today and doing this wellness check with all of you.
Yes. Well, thank you so much for joining us, Dr. Sis. And I hope you all heard it's Dr. Sis on your social media. Is that right?
Yes.
Follow you?
Yep, it's Dr. Sis on Facebook, and on Instagram is Dr. Cislina, Sislena.
Awesome. Well, my name is Devyn. I am a board certified family nurse practitioner. I scooted up so you guys could hear me, but I'm not sure if it cut me off. Anyway, so practitioner means that I take care of people from birth to death across the spectrum of different healthcare concerns. So I specialize in my day job. I work in a cardiology practice, so we really focus on just cardiac conditions for that. But what my training is for and what I love doing is family nurse practitioner work, meaning taking care of people across the spectrum of age. You know, we say from womb to tomb.
That's it.
Yeah. And the reason that both of us are coming on tonight is because we understand that when it comes to health, it's not just physical health, which is what I focus on with my patients, but mental health and just life in general, and figuring out how to navigate through such a very difficult time when so many people are experiencing so many different life changes. So I'm going to be talking to you all about how to get your healthcare needs met during this unprecedented time. And my good friend, Dr. Sis, will talk all about accessing life coaching and other time. She can tell you what she's
That's right. Well, because here's what's so fun about this. First of all, they have let the aunties out on social media. I can't believe it. So everybody who wasn't cool is all of a sudden cool. So I'm just glad to be counted among the almost cool people. And so we literally put this together and thought that you would be excited to hear from us. And we're capturing like the biopsychosocial model. Like we're covering the mind, we're covering the body. And while they're talking about sheltering in place and quarantine and lockdown and isolation and all of those new terms that have just entered into the lexicon, we're talking about all of that.
Yeah.
And today, we really just wanted to check in with you to see, you know, if you have questions as we think about navigating this new normal. What kinds of questions do you have? Because we're thinking about maybe making this a series and coming back and talking to you again. And I will be talking about the things that have to do with the anxiety that's in our space right now. And so many times when we talk about this new pandemic, we're really not managing the pandemic by itself as much as the physical stuff, as much as we're managing fear.
Right.
And we're managing anxiety. And so I was on with a friend about a week ago, and she said, Cislina, people aren't breathing. People are not breathing. And so that night I did an Instagram live, like my first. So I think I was initiated into the cool on that night, but I did my first IG live and I just did breathing.
Yeah.
So, you know, and how important, Devyn, when you think about breathing and the link to the fact that just this illness has attacked our breath, what kinds of things come to mind for you with the population that you deal with? Because you've got the cardiology people.
Yeah.
They are vulnerable.
Yes. Our patient population is very vulnerable. A lot of the times what dying from COVID looks like is like heart failure, death. So the symptoms of COVID-19 happen to be very similar to some of the symptoms that our heart failure patients have anyway. So it's another layer of anxiety on this already super anxious time. When I talk about breathing, which I talk about more often than people might think in my work, but I can look at an EKG and tell if somebody is having like sleep apnea type symptoms. Hold your breath. So let me explain really quick. Sleep apnea is just not breathing for prolonged periods of time while you're sleeping. And the damage that just not breathing does to your whole system is unbelievable. So yes, even there, I'm making, without COVID-19, making plenty of referrals for people to get a sleep study and to wear a CPAP mask, which is a positive pressure mask while they sleep, so that that doesn't happen. One of the questions that I have been getting all the time is to talk about hydroxychloroquine or Plaquenil. Plaquenil, if you haven't heard of it, you haven't been watching the news, maybe you're not as anxious as the rest of the population. But it's a medicine that is an anti-malarial drug, okay? And there's been a lot of misinformation swirling around the news about this drug, along with another drug called azithromycin, being able to treat COVID-19. In medicine, the way things work is there has to be random controlled trials. We don't just say, hey, I got a good feeling about this. I think this is a good idea. Let's try it. We have people's lives in our hands. So I have been getting half a dozen to a dozen requests for Plaquenil in my practice. And people are anxious, they're worried. So I never just say, sorry, not going to give it to you. It's like, okay, let's talk about why you think you need this medication. Because the truth is, the treatment for COVID-19 is symptomatic treatment until it progresses to a point where a patient or a person needs to be hospitalized. So that's one of the questions I've been getting a lot. What about, can I get this drug? Can you prescribe me this drug?
Yeah. And I wonder, as you think about that, if, there is a delicate balance between trying to sort of quell the fears of the public and being slightly irresponsible with your rhetoric, because when people come in and they are motivated by fear, even if it's not COVID-19, and they're asking because they're having trouble, because as I say to my docs, just because you're having respiratory issues doesn't mean you have COVID. There are a whole lot of other things that could be happening. And so I wonder what you think about how, even as we think about our national leaders, managing fear versus going out and being irresponsible with our language, and how then do you manage that, and what does that cause for you, because you're on the front lines and you're in the clinic every day and you see this.
So what that does for us is our phone systems, our telephone systems are totally overwhelmed. Patients are calling and they're panicked and they're worried, and everything sounds and feels like COVID right now. I'm pretty sure that everybody who's on this webinar has had a symptom over the past month that made you go, oh no, I wonder if this is it. The training is different. So I don't know how politicians are trained, but I will say that they're put on the spot. they're put on the spot and they want to say something, especially during an election season, that makes people think, oh yeah, I like what this person's saying. They make me feel good. In medicine, we're trained to give false hope. In fact, that's something that we really try to steer clear of. If we don't know, then we don't know. If we're still doing testing, then we're still doing testing. If we need to have a deeper conversation about end of life planning or the terminal nature of a disease, then we call in our palliative care team. We call in folks who can, set up longer appointment times to really sit and talk with people about what they're truly facing. So that has made things a little difficult on our end, because as soon as people know what to ask for, they come and they ask. So it makes it difficult, but it's just like, I don't know how many of you have played sports, but I used to coach basketball and I coached volleyball, and there's this idea of touches on the ball. However many touches they get, it's a good thing. More touches, the better chance that that player is actually learning what to do when the ball's in their hands. And I think about patient care in the same way. Touch is never wasted. If I get a phone call and it's a really ridiculous request and it makes no sense, and I know I'm going to turn them away, with regard to that request, I'm still going to provide education. I'm still going to let them know what the real symptoms are and when they do need to seek care, as well as make sure that they know how to get in contact with their healthcare provider while they are not able to come into the clinic.
Yeah. So, and you mentioned something that I want to make sure that our guests understand when you said that we're really treating, maybe I'm breaking it down a little further, but what you meant was that you're really treating symptoms because there's no cure. And you're really trying to make sure that people recognize that when they come or when they are being treated, it's not the cure. It's not even to necessarily, you're not giving them something to necessarily make them better. It's just you're treating symptoms and you're trying to make them feel better.
Yeah, so I liken it to the cold. When you have a cold, I'm not saying that a cold is as serious as COVID or vice versa, but they're both viral illnesses. So you don't treat with antibiotics. You don't attack the virus itself per se. You manage the symptoms that the virus is causing so that that person can be more comfortable and heal up. These are also, there's something in medicine called self-limited disease. And what that means is it's going to stop on its own.
Right.
It's not progressive, okay? So hypertension, progressive. If you don't do something about it, it gets worse and it wreaks havoc on your symptoms.
Right.
Okay?
Right.
Seasonal allergies, self-limited. Once that season is over, those symptoms subside. And so COVID acting like a self-limited illness in the vast majority of people, but in a small minority of folks who we were saying were people with underlying conditions. And we're learning as this goes, right? Because this is new. This is a novel or new coronavirus. We're learning that not always that have underlying conditions. We're seeing runners and singers, people who are just sucking air down. So yeah, I hope that answered your question.
Oh, I think so. I think so. I'm like jumping right into interviewer mode because it's just what I like to do because I'm so curious. But I want to also just share, because you did mention sleep. And I want to share with our people that being physically attuned, exercise, eating healthy, and making sure you sleep. I know it sounds like a broken record because everybody says it, but it's really important, particularly now, because it is so easy to slip off routine. When you're in a normal work environment, for people, especially that used to go into work and sit at an office, sit in a desk, and then you get all of these ambient cues about when you get up for lunch, about when you kind of just take a walk down the steps, about when you take your 15-minute or 30-minute or half an hour break. You had all of these cues around for when you were doing things. Now that our routine has been disrupted, it is so easy to sit at the computer for 4 or 5 hours at a time with only getting up for just quick breaks, without making sure you continue to move, without making sure that you actually maintain some level of health. One of the things that I am just starting to do now, because I'm starting to see the pounds creep up, is I'm going to start putting on my tight jeans. Everybody has a pair. Because I feel like if I can't button those, or if they're feeling tight, I need to rein it in. Because otherwise I'm just wearing spandex, I'm wearing things that stretch, I'm wearing my slouchy jeans on my sweats. And it really can be a check for you, because you're gonna have to insert cues that says, okay, my eating is a little bit off. I need to kind of rein some things in. And when you do that, you boost your immunity. Like everybody's wearing masks and they're N95 and they're regular cloths, and that's now saying wear bandanas. The other thing that we can control is how we treat our bodies right now. It's really important to make sure that we think about that and the things that we can control, because it's so easy to just fall off the bandwagon.
Oh, we all just got pushed off the bandwagon. Are you kidding?
Oh, yeah,
You spoke a word. This happens all the time in nursing. Nurses wear scrubs, and next thing you know, you go to put your jeans on for a vacation and they do not fit. I love that, putting your tight jeans on. You might get your feelings hurt, but you'll find the problem early on. When I think about viruses, and viruses are kind of nasty. I don't know if you guys remember microbiology, and just even the way they look. They just look like they're trying to get in and they are. But I think about the immune system like a gate, right? And if that gate gets low enough, that virus can hop on over.
Yes.
So the things that lower the gate are poor nutrition, lack of sleep, stress, which is so hard right now. If you're not working because of this pandemic, where your next check's coming from or how much it's going to be, how do you not stress? Just the residual of what's happening alone is going to take your immune system down. So we have to be even more vigilant and shoring up our immune system so that we're not one of those vulnerable people if we come into contact with this virus. So yes to vitamin C. Is it a cure? No. Does it help shore up your immune system? Yes. Yes to vitamin C. Yes to elderberry. Yes to zinc. I say, because these are things that actually help shore up your immune system. But also, and this is something that I've really been taking advantage of lately, I can't even say it without smiling, but a peace practice.
Absolutely.
This is a great time to start yoga, a home yoga practice, a home sitting practice. And when I say sitting, I do actually mean sitting, quietly. I think of prayer like talking to God, meditation like listening, hearing from God, and really starting to start our day and plan into our day these peace practices, whether it's an embodiment practice like yoga or Tai Chi, or something where you're in your body and moving, or whether it's sitting and meditating or taking a bath. A bath is such a it's hard to be mad in the bathtub.
It's hard to be mad.
Hard to be when you're immersed in a bubble bath with some oil and a candle burning and your favorite music playing. All of those things, even a conversation with a loved one, that lower our stress level, which in turn makes our immune system stronger and makes us less vulnerable. Worrying about the virus, believe it or not, is almost calling it in.
That's right.
So we have to do what we know: wash our hands, wipe our surfaces.
That's right. That's right.
Socially distance.
That's right.
Home.
That's right. In fact, one of the I had, and I've been kind of going through these tips as I've been talking, but I've got these 5 tips, and I'm just going to run through them. But then I'm going to get back to. I want to circle back to something that you said. So the first one is breathing, and that completely relates to what you were talking about. Developing a practice, and deep breathing is just lovely. If you have not tried If you've not tried it, you should absolutely try deep breathing. You don't need any manual. You can just really get connected to your breath and go deep. Acts of kindness, that's number two. Acts of kindness, anybody can do good work and be kind to someone else. Focus on what you can control. That is, we feel so out of control, all of us, and none of us are exempt. But finding a way to control what you can, including the breath that you have and maybe the bath that you take in the evening. Exercise, eat healthy, and sleep. That's one I already gave you. And then develop a gratitude practice. So I wanted to sort of just drop those on you because I don't know, how much time that we have left. And I wanted to leave you with those. Now, I will tell you, I'm part academic, and academics steal from other academics. And so I stole that from the sister at Yale who is now doing her open class on pathways to happiness with over 1 million subscribers now to her online class. And so I wanted to make sure to get through all of those, but to sort of circle back to something you said, Devyn, we have started talking about on campus physical distancing because we want people, particularly when you think about students, to maintain social connections. Right. And so when we think about social distancing, it's almost like a misnomer. We're telling people don't be social, and we're not really saying don't be social. We're saying be physically distanced, but remain connected. Call your mama, call your sister, call your brother, call your daddy, your pawpaw. As the Surgeon General said today, big mama, pop, call all of these people and stay connected, because those are the connections that are going to help all of us get through. And all of us, I think, in some ways are struggling in different areas. We were just kind of talking about friends of ours just all across the country who are struggling with different things. And so nobody is really, goes unscathed from this. It really touches every life. And if you're not feeling the direct impact, and I cannot imagine that you wouldn't, then somebody very close to you is being, but this is just, it's unbelievable. And when it first happened, and it still does feel this way to me, I felt like I was in the Twilight Zone. I felt like this was a movie.
Yeah.
That's how intense it felt. And so for me, it's really about trying to make sure that I stay focused on those things that I can control, and staying, particularly connected to breath. I'm still working on the sleep thing because I like books on tape, and I'm now consuming like a book a week. I just love books. So I have them playing at night, and it's just like, at some point I'm gonna have to shut this down because I could just go. And I've been doing a lot of books on tape.
Oh, sleep hygiene. We like this conversation, especially for our kids too, because the kids, this is a time where you just give them their electronics. You don't fight them and say, oh, you've already had your hour for today. I think children get overlooked a lot of times in crisis because they don't have to worry about finding out how to pay the bill. They don't have to figure out how to feed the family. But our children in my state, in Washington state, there is no more face-to-face education for the remainder of the school year. So we're talking about seniors not being able to experience the second half of their senior year. We're talking about kindergartners who are just now learning how to go to school, who will be behind that social curve when they come back in the fall, hopefully in the fall, as first graders. So I want to repeat your tips back to you because I missed the last one, but also because I want to make sure to put it in the notes. So breathing, connecting to breath, acts of kindness, control what you can control, exercise, eat healthy, and sleep.
And gratitude.
Gratitude, practicing gratitude.
Gratitude. So really being thankful for what it is that we can be grateful for. Because there's always a silver lining. There's always something to be grateful for. And for those people who think that this mental health and well-being stuff is just sort of pie in the sky, talk about clinical trials. There have been study after study after study that links our well-being, our physical well-being, to our emotional well-being. And so when I talk about that triad, the biopsychosocial, I really am talking about what are the social practices that you have that really help you remain healthy. It reminds me of a statistic that I recently saw, which is that domestic violence is up north of 36% and higher in many communities. And what that says to me is that there's a whole population of people that we have not thought about when we start talking about stay at home, stay safe, be safe, because home for these people is not safe. And so when we think about the whole biopsychosocial, all of those things, our social environment, our physical health, our mental health, all of those things work in tandem. If any of those are off, the other ones are going to be off. And so it's really important that we think about creating a healthy triad, a healthy triangle. And then, they're not going to be perfect because they never are really perfect, but you have to give attention to all of them in order to move through this space and survive and come out on the other side with some sense of wellness.
I mentioned earlier that that's wonderful and so true. I mentioned earlier that I used to coach basketball, and I coached kindergartners and first graders. And let me tell you something, these kids, who's going through it and who's not. And I learned this also, seeing children in clinic for their well child checks and for their, physicals for their sports. They see and hear all of it, but they don't have the capacity to process it in the ways that we can. So we process it with what they have. And when I used to coach basketball, I would say, I told the kids, this is our hour. This is our hour, So for this hour, we're going to have fun. For this hour, we're going to have support. For this hour, we've got each other's backs and we're all friends and we take care of each other.
Yeah.
And that's a thing that happens in schools as well. For some of these kids, it was just, I just got to get through the weekend and then I can go back to school where I have a support system and food and people who care about me. So the children have been very, very high on my prayer list. Who advocates for kids when they don't have an advocate? So those of you who are praying folk, please lift up the children and the adults who are in situations that are, abusive and
That's right.
supportive.
That's right. That's right. And I think one of the things that you said, and I just want to punctuate, is that routine is really important for children. And so during this time, if there are children that you know of who have anxiety, just for whatever reason, natural anxiety, one of the things that you can do to support children with anxiety is to get them on a routine and stick to the routine. Now, for the first week or so, everybody is off routine. They're trying to figure it out, which way is up, who's on first, what do we do? But to the extent that you can get back to a routine, kids thrive on routine. They might buck a little bit, but they actually appreciate it and they do much better with routine than they do sort of with this sort of open-ended, haphazard way of living. And so I think that's one of the things that I've been really fortunate to do for my children in particular, is to keep them on a routine. It's a lot easier when you have school and all of these, signs, but to the extent you can do that, it really does help them, particularly those who are vulnerable.
It really does. And there's a lot of stuff going around on Facebook and on social media, like, it's okay if you don't know how to homeschool. It's okay if you don't know how to do this. And while it is okay, and while we are dealing with this, like I've been saying to my patients, it's like laying the track while the train is coming.
Yes.
The routine is still very important, even if the routine is, my kids were little, we'd say sit and stare or brain and body. So this might be a sit and stare hour where you can sit and read your book or watch a TV show or use your tablet. Okay, this is a brain and body hour. We can do puzzles, we can move around, do yard work, clean house, whatever the case may be. No, you don't need to have a teaching certificate to get through it.
No.
Structure is so important.
It is.
I want to switch gears real quick and just give you guys some tips of my own for your health care, okay? Because if you have tried to call your doctor's office and make an appointment, you may have been met with some new challenges We're not having people come in and sit huddled up in a waiting area where they can potentially, you know, be exposed, right? We're doing a lot of telemedicine, and telemedicine has actually been around for a while. It's, if you've ever called in and spoken with a nurse who talked to the clinician and got back to you with advice, that's telemedicine. And you can also, just how we're seeing each other over this screen, you can see your clinician through a screen just like this. So if you have not already gone to your practice's website and signed up for, sometimes it's called a patient portal, sometimes it's called My Chart, sometimes who knows what it's called. It might just say telemedicine or telehealth.
Right, right.
This is not a time to not get your medications refilled, because again, having underlying conditions makes you more vulnerable. So if you need your blood pressure medication refilled and your bottle says no further refills, don't just say, oh, I got to wait until COVID's over. No, you still have to keep that in check.
That's right.
Call your office, find out how they're taking care of patients, how they can refill your meds. When you're getting your meds refilled, get a 90-day refill. If you can afford it, if your insurance covers it, ask for a 90-day refill so you don't have to keep going back and forth, and at least you don't have to worry about it for 3 months. There are some tricks to getting meds for a little cheaper. One are $4 med lists, and you can Google $4 med lists. This is very helpful if you're on a lot of medications, or if your money's down and you just don't know how much your next check's going to be or where it's coming from. Google $4 med lists. Walgreens has them. Walmart has them.
Yep.
CVS has them. And it might not be a pharmacy that you use, but it might be a pharmacy that you have to use until all of this is over, okay? So a lot of times there are $4 for 1 month, $10 for 3 months, or just something like that. Also, goodrx.com.
Oh, yeah.
GoodRx will give you coupons for medications that you already take. So if you have a medicine that costs you a lot of money and you're like, oh my gosh, I'm out of work, or I'm just trying to pinch my penny, let's really know where this is going, go to goodrx.com. Type in the name of your medication as well as your zip code or where you live, and it'll bring up pharmacies in your area and what the cost of the medicine is at those pharmacies. Now, you got to pay attention to what the coupon says. If it says it's for a 20 milligram lisinopril pill and your prescription is for 30 milligrams a day, when you talk with your prescriber, you want to make sure that you ask for the 20 milligram pill so you can take 1.5 a day. Otherwise, the coupon will not be valid if they send in, a 10 milligram or a 40 milligram lisinopril, okay? The prescription has to match what the coupon says. So find the coupon, find what pharmacy you're going to use, and reach out to your clinician through your patient portal or your My Chart, or however you're communicating with them during this time. Reach out to them, tell them exactly what it is that you need, and they should be able to send that in for you, no problem. If you have a smartphone, you can do telemedicine. If you have a laptop or a desktop, you can do it. If you have none of the above and all you have is a phone, call them, because on the other end, I'm guaranteeing you, everybody who is trying to maintain some sort of business has come up with a modality to take care of patients from a distance right now. So really quick to review those, you want to sign up for your patient portal. You want to look at your medications, see what you need refills for, and find the most cost-effective way to get your refills. That might be the $4 med list that you can Google and look. The meds are usually categorized under systems, so it might be heart meds, cholesterol meds, diabetic meds, but see where they have it. It's going to be more work on your part. But I always think that's a good thing, because you might have been overpaying for your meds for the past 3 or 4 years and didn't even know.
Right, or
So,
30. Mhm.
right, exactly. So find where you can get it for cheaper and then request that specific thing to your clinician. For instance, I take hydrochlorothiazide every day. Yes, I do. 25 milligrams. Yes, I do, because I got hypertension and I'm not playing about that. So I could just say, oh, I've got good insurance and use my neighborhood pharmacy and pay $12 a month, let's say. That same medicine might be available on the $4 med list at Walmart. So I want to call my clinician and say, hey, I would like 90 days worth of my hydrochlorothiazide. It has to be the 25 milligram tablet, but I need you to send it to the Walmart pharmacy
Mhm.
rather than, where I've been picking it up. And you can do that with GoodRx or with the Ford list. So that's very, very important. Diabetics y'all do not need to be going without your meds right now. We can help. Just call the clinic and figure out what it is that you need, the small adjustments that you might need to make on your end to get what you need. Um, I see a question and I want to answer. This question is coming from Courtney. Are people with pulmonary embolisms at more risk for having respiratory complications if they get COVID? That's a great, great question, Courtney. And I think there's two ways to look at this. When it comes to pulmonary embolism, so for those of you who don't know, this is a blood clot that gets into the lungs. Okay, you can have acute, you can have chronic, and you can have resolved. So if you've completed your therapy, Courtney, you should not be at a higher risk, but you are somebody that we want to hear from right away if you developed symptoms, okay? If you have an acute pulmonary embolism, you better be in an ambulance on your way to the hospital, because that is a deadly diagnosis. For somebody who has a chronic blood clot situation, yes, they're going to be at greater risk. And I know that that was probably really confusing, but the thing about the COVID virus, the COVID-19 virus, is any virus, they specifically attack certain tissues. And this particular strain attacks the lungs. So anybody whose lungs are compromised are going to be at a greater risk to have a very bad case of COVID.
Yeah.
Okay, so let me know if that answered your question, Courtney. Somebody who has a history of a serious pulmonary condition like a pulmonary embolism, like COPD, like asthma. Hello, asthma is very serious. It might be very common, but asthma is very serious. If you have an underlying pulmonary condition and you develop these symptoms of fever and dry cough and body aches, you got to reach out and call your clinician office. Reach out to them through the portal, reach out to them over the phone, get a telemedicine appointment. We want to test you and we want to protect you. So that's a wonderful question. Thank you.
I want to add a couple of more symptoms they were sort of late breaking symptoms, but those symptoms that are the lack of taste and the lack of smell suggest that the occipital nerve and the occipital lobe in the brain is also attacked in this COVID-19 virus. And so there's lots of research that's still out on that, but studies are suggesting, just based on what the symptomology that people are reporting, with loss of taste, not being able to taste your food, and loss of smell, is that whole olfactory area is being impacted also. So there's no real one size fits all in terms of symptoms, but they are starting to learn a lot. And that's the tricky part when you have a brand new disease like COVID-19.
That is a really tricky thing, because the symptoms, like symptoms of anxiety, can often mimic cardiac symptoms. So we see a lot of people who are having palpitations and there's nothing wrong with their heart.
Yes.
It turns out to be an anxiety condition. With COVID, and with anything, I want to talk about a symptom. that you guys may not have heard of, but always warrants attention. And it's called impending doom. Impending doom. If you have ever felt that, then you probably identified right away with just those two words. But that's when you feel like something's wrong. Something's wrong. Something's wrong. You'll see restlessness as a primary presentation in somebody that has impending doom. They can't be still. They just can't. They want to get up. They're trying to take a breath. They're fidgety. That's a symptom that warrants, further investigation.
Yeah.
So you're going to go to that family member, that person, and say, "Tell me what you feel in your body, no matter how crazy it sounds."
Yeah.
While you're calling the doctor's office, if not 911. A lot of people may not have a oximeter at home, but if you have one, that's a great thing that can be a really good way to screen, because panic feels like you can't breathe.
Mm.
But if you put an oximeter on your finger and you're actually getting 95% or better of oxygenation when you take deep breaths, then probably not something that's compromising your lungs. But impending doom, just something's just not right. And quick story, I experienced that a couple of months back. I pulled my car over to the side of the road. I didn't know if I could make it home. I had a weird craving. I wanted orange juice. So I literally went in the store and got some orange juice and drank it. I got myself home. I got in the bed. I told my husband, "I don't know what's the matter with me. I feel like I might not wake up." Not something that you tell your spouse, of course. He took
Oh
me
my goodness. Poor me.
but I really couldn't explain it past that. Turns out my potassium was like 2.9,
Okay.
which is very low when it comes to potassium. And they gave me some potassium IV. That could have gone into something way worse that I won't even get into, but deadly arrhythmias. But what was the symptom? Restlessness, impending doom. Impending doom usually means something.
Mm.
It might just be a panic attack, but if you've ever had a panic attack, you probably don't use the sentence "just a panic attack." Guys, let us know where you're tuned in from. Let us see you in the
Yeah,
chat.
tell us.
What
So
questions?
what, you see names?
I see names. I do. Are you not seeing them over? Did you click on your chat
I have
system?
to open the chat.
So I've seen one question over
Okay.
there. We're the last 15 minutes really is you guys' time. Like Cicely said, we are thinking about doing a series in the future.
Yeah.
Different.
And because we don't want to end on impending doom, well, let me just give you a few things to pick you back up, because the silver lining around the wellness and the mental health piece is that speak about, when you talk about things that you can control and the things that we have at least been doing, dance more. Like, you don't have to have a club to dance. So I had a full dance party the other night just by myself, because my boys were not trying to feel the 90s hip hop. Like, they feel it, but they were just not really getting with it. So I had a whole dance party. And so think about dancing and really creating some lightness around that. And the other thing is, so many of us, when we go into work and we talk about all of these things that we don't get to do. And so this might be that time to pull out that passion project.
Yes.
That you have been talking about, thinking about, wanting to do, your side gig, your side business, your hobby, whatever it happens to be, whether it's gardening or starting your entrepreneurial pursuits or whatever it happens to be, doing your first IG Live. This is an opportunity for you to do so many of the things that you have been putting off because you haven't really had the time. And the one thing, even if you're working at home and you feel like, you are certainly they're getting their money's worth, because work from home is no joke. You have a couple of extra hours built in if you had a commute, or an extra 30 minutes. So whatever that happened to be, you have that time in order to focus on some of the things that really are that you're passionate about. And then the other thing that I talked a little bit about, books. This is a great time to edify and to read and to lift your level of education and just have some fun reading. I mean, if you don't like to read the paper books, you can do books on tape. There's so many things that you can learn right now that you might be able to pick up on a book. And then finally, walking. You might be able to get some walking in. And even if you can't, like my son who's started this new page around calisthenics, because the gyms are closed, right? So there are no gyms, and there are those that love gyms, and then there are those that maybe don't necessarily have to do the gym. And so now he's going to the field and making us feel guilty. So we're going to the field and we're working out and we're doing push-ups and sit-ups. Clearly not enough because my tight jeans are too tight, but that's an opportunity for you you can always walk there. You do not have to have a gym to do some calisthenics and get your workout in. So that's just really a plug. I'm talking to you, but I'm also talking to me, because just keeping it moving and doing some things, working out, you can work out, you can dance, you can walk up and down, just get it in, get that heart rate up, and keep it moving. It really is good it's good for the body, and it's also good for the soul. It's really good for you.
I'm gonna get a little bit hippie, because that's just who I am, for those of you who know me. But, I think about what we're being called to. What does all of this mean? How could all of this happen? And I want to pose a question to you all. How many of you were wondering where you could find more time a month before the COVID-19 pandemic? How many of you were wanting for more time with your spouse or your partner or your children? How many of you were wanting for just more time at home? I can say I love my home, but I just felt like I wasn't getting to be there as much. What are we being called to? What opportunity? And I'm not talking about rise and grind Twitter. Like, now's the time, bust out, get this done, da 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 da. Because yes, for some of us, we're built that way, and we're looking for the entrepreneurial opportunity and how we can, create and build wealth during this time. But some of us really need to take a step back and look at what our lives looked like a week before sheltering in, a month before. And we don't often have time to think about that. We go from one thing to the next, from home to work, from work to pick up the kids, from picking up the kids to getting dinner, and, shower and get up and do it all over again. We have a little time right now. We have a little time collectively, Dr. Sis talked about going live on Instagram. Hey, you know how many people are on Instagram right now? This is a great time to test your chops on something like that. We're doing that actually right now. This is my first webinar, y'all. never done this before, but really, to take inventory. Look at yourself in the mirror without your clothes on. You might wonder how you got there.
That's right.
Start coming up with things that you can put into place now. They say it takes 21 days to make a habit. We've got more than 21 days of being on this quarantine. So what habits can we create that are going to be an investment that continues to give to us and to our children and to our relationships and to ourselves,
Absolutely.
I get massages every other week. I'm so spoiled. My massages are canceled through the end of May. And so, I get pain and tension in certain places. And instead of running to the fix for that, I have to sit with that. And I have to face that and ask myself questions that I've never really had to get in the habit of asking, like, why do I keep re-injuring the same? Isn't that insanity? They say when you keep doing the same thing, different. And so I have to sit with my own insanity and go, okay, girl, now that that is not an option, what are you going to do about this?
Yeah.
And so more attention on the little things that add up in our lives. I see a question here talking about fresh air. Should we jog or walk long distances for exercise, or is that restricted because the virus stays in the air for 3 hours? I had a private conversation with somebody earlier today, and the gist of that was, you will not see me out. You will not see me out right now running. I think taking a walk around your neighborhood or a place that is incredibly spacious, and I do mean a walk, running makes me nervous right now because we huff and we puff.
Yeah, we do.
There was a corral that was meeting right across the street from my job, and I actually lost a patient in this. They continued to meet and were going to their choir practice, uh,
Ooh,
and people who were healthy got corona. Actually, a couple dozen of them got it. Um,
really?
Yes, ma'am. And all they were doing was singing. So to tell you the truth, I had a moment yesterday. Those of you who know me really well know I also sing, and I have been afraid to sing. You see what I'm saying when I talk about how this is affecting our mental health in ways
Yes.
never before. That's
Yes.
an outlet for me, and I've been scared to do it.
Yes.
So I had a little moment. I did
Yeah,
sing
and
in
yeah,
my house. But yeah, I think
yeah,
we have to be really cognizant of how many people have been in an area in the past few hours. So I think doing things in the early morning is probably safer. And how deeply are we breathing in the air that's around us?
right, right.
Hope
And
that.
not only not only because of those people, but because there's so much, well, not necessarily conclusive, but non-conclusive data on the carriers. And so I work at a whole institution of carriers. They say that young people are primarily those who are carriers and might be asymptomatic. And so it's not just about the people that are around you, that you may be ingesting their droplets, but you also could be a carrier and not know it and be completely asymptomatic. So right now, because of community spread, the advice that we're giving to our population, and certainly in our homes, is you need to kind of move and function as if you have it, so that you're protecting yourself and you're also protecting others.
Absolutely. My mom actually lived with us for the past year and a half, and is staying currently with my younger brother over in Norway because I'm continuing to go to work right now. I'm going to a hospital every day.
Yeah.
Um, Doing a lot more work from home, but still going in a couple of times a week. And yeah, I might get COVID and be just fine or feel poorly for a couple of days. My mom wouldn't do so well with that. So that's really good advice. We're coming close on an hour. So I want to personally thank each and every one of you who joined us. We will have more notice in the future should we do this again. You
Yeah.
can find me on social media at DtheNP. So the D is like Devyn and NP like nurse practitioner. And that is on Twitter, on Facebook, and on Instagram. I also host a podcast called The Purple Stethoscope. And the purpose of that is really just to raise health literacy in the community and just get people really patient level information about how to get well and stay well. So that's where you guys can find me. And I'd love to hear feedback on whether or not we should do more of this or more focused or topical. Let us know.
Yeah, that's right. That's right. And so you can find me at Dr. Sis on Twitter and on Facebook, and Dr. Sislina on Instagram. And so
I'm gonna type
come and
that
check
in.
me out. Come and check me out. Oh, in the chat.
Yeah, can you type yours in the chat?
Yep, I sure can.
Listen, the aunties are out for real.
Right.
So that's my handle. It's all those different places. And there's Dr. Sis.
And IG. No, Dr. Sislina at IG and Twitter. You know what?
All
You'll
right.
find me.
This conversation has been recorded. You'll be able to catch the replay on YouTube and my YouTube. I think if you search DtheNP.
Mine is Dr. Sis, but I haven't used it in so long, but I'll put this on.
There you go. There you go. All right, you guys, stay well, stay hopeful. The better we all raise and shore up our immunity with our wellness practices, with our social practices, even though we're physically distancing, the sooner this thing can be done with and get on with. And my hope is that none of us come out the same. We should all be changed
Right.
by
That's right.
and changed for the better, I pray. So thank you.
Absolutely. Breathe deeply, deeply and safely. That's right. All right. God bless you all. We'll see you.
God bless you all.
All right.
Bye.
Bye.